Okay, a scalp biopsy is a short process where you get a small sample of tissue, that scalp tissue, which has hair in its natural state. You obtain that sample and you send it off to a specialist to take a look at it. It helps us understand what's going on beneath the hair follicles, so both in the tissue and to understand why one may be losing hair. Okay, so as we all know, alopecia is just the medical term for hair loss, and there are many different causes of hair loss, many different reasons people lose hair. Sometimes it's not so clear. Not everyone has a clear pattern of, say, male pattern hair loss or female pattern hair loss. It can be a combination of things happening beneath the skin. So when you have complex cases like that, typically when scarring alopecia, for example, is suspected, or even if someone has had a hair transplant and it's not worked, if the if a scarring alopecia had not been appropriately excluded to start with, a scalp biopsy would be helpful. So not everyone needs a scalp biopsy. However, it's taking into account the clinical thing that's happening with that patient. And a scalp biopsy can help interpret or help us doctors understand what's really causing hair loss in the patient. Okay, like with any biopsy, when you're taking a small sample of skin and tissue, there's a small risk of bleeding. Usually that's minimal and it's controlled during the procedure. The risk of infection is so small, it's probably quoted as less than 1 in 5,000. But still, you're making a breach of the skin, so one needs to be aware of that potential. Discomfort is the only other thing I'd say, but most of my patients say I made them take paracetamol afterwards. I don't like pain, so I make people take paracetamol, but outside of that, one would just feel tenderness afterwards, and that's it. The real concern is actually we're taking a sample of tissue to understand what's going on beneath the skin. Occasionally, it'll come back and not make us any clearer. So a scalp biopsy by itself, standalone, is not of great use. You need to understand the clinical story for that patient and see if a scalp biopsy is appropriate. And all of that together is like a jigsaw puzzle to give you a clearer picture and a clearer understanding of the alopecia. Okay, so it's really helpful in that patients interested in a hair transplant, for example, if there's a suspicion for scarring alopecia, if it's not correctly identified, you have stories of someone proceeding with a hair transplant and then coming to find someone like me many years down the line wondering why the transplant hasn't worked. So it'll help determine the best course of treatment and to see if one is suitable for surgery or not. So I can phrase that better. A scalp biopsy is not a necessary thing for most people, but if there's a suspicion of a scarring alopecia, it helps us make the correct diagnosis so that you have the correct treatment and that you're seen by your dermatologist or the correct hair specialist once we know what's going on beneath your skin. Do you know, it's quite straightforward actually. So afterwards, people return to their normal day-to-day life. There's a little bit of tenderness that may persist for a few days. But some people, like I say, I encourage people to take something simple like paracetamol. The stitches we use are dissolving stitches, so there's nothing to remove afterwards. But in some people, that may stay for up to 6 or 8 weeks. So if it becomes uncomfortable, that may be cut out. But for the most part, after 24 hours, you can start using your hair care. If you use Topic in your hair, for example. Oh, can I do that again? Sorry.
Sure, don't worry. I'll
Just
ask
one.
you. I'll ask you the question again whenever you're ready, and we'll have another take.
Okay.
Perfect. So once again, what can I expect during the recovery process after a scalp biopsy?
Okay, so a scalp biopsy is a straightforward minor procedure. Now, the site is closed, the biopsy site is closed with dissolving stitches. And literally, apart from needing to wait for the dissolving stitches to absorb and perhaps an element of tenderness for a few days after the biopsy, there's really nothing else to worry about. We encourage our patients to keep their area nice and clean. A wound's not watertight for at least 5 days, so you wouldn't be going swimming until after 5 days. Otherwise, people bounce back to their normal day-to-day life, so you can go back to work immediately after scalp biopsy if you choose to.